Welcome to Dr. Osborne's Zone. Today I'm covering how a simple vitamin deficiency may have tricked your doctor and put you on the wrong path of taking medications and treatment that might not be necessary. Maybe you're thinking that's not possible. Well, think again. You probably didn't know this, but most doctors don't study nutrition at all. Let's look at how nutrition gets covered in medical school. And as always, if you want the show notes, type in wrong diagnosis below and I'll get you all the slides. Let's look at nutrition in medical school. So this was a published paper in the journal Advances in Nutrition.
Okay, we can cut it.
Look at the first sentence here. The importance of nutrition in the development of disease and in the recovery from illness is among the most fundamental tenets in human biology and optimal health. Now that's the first sentence. And the authors later in the paper, they put this direct translation from the Greek Hippocratic Oath. And what is that translation? The first do no harm oath. It states this: I will apply dietetic. What does dietetic mean? It means nutrition. I will apply dietetic and lifestyle measures to help the sick to my best ability and judgment. I will protect them from harm and injustice. That's the Hippocratic Oath. Now, think about that for a minute. I will apply nutrition. Now let's look at the nutritional training in medical schools as we speak today. Recent data show that 75% of U.S. medical schools have no required clinical nutrition classes. That's 3/4. 75% have no requirement whatsoever for nutritional training. 14% of residency programs have a required nutritional curriculum. So if your doctor went on and specialized in something else, there's a 14% chance that maybe he got some nutrition. More troubling, only 14% of current healthcare providers feel comfortable discussing nutrition with their patients. Now, when was this study done? When was this data pulled? This is 2024. So this isn't old. This is still current. 75% of schools don't have training. 14% have some residency programs with some required training. And only 14% of doctors even have a level of comfort talking about this topic. Nutrition was fundamental in many traditional forms of medicine until its role in medical care experienced a rapid decline over the last century. So what we've had in the last century is pharmaceutical takeover of medical schools and a displacement of that curriculum with a replacement of curriculum focused on drugs and surgical treatment options, not nutritional options. These authors believe a key cause of the decline in nutrition's essential role in healthcare and preventable medicine is the escalating crisis of inadequate nutrition education and medical training. It's a major problem. Down here, the statement of significance. Currently, there is a crisis of inadequate nutrition education and medical training, with recent data showing 75% of U.S. medical schools and 86% of residency programs have no required clinical nutrition training. More troubling, only 14% feel comfortable about talking about nutrition with their patients. Now, this was another study here where they were comparing U.S. medical school training with French medical school training. And so just some bullets here. In the U.S., it's not taught in every school. As I just showed you, 75% of schools don't teach it. There is no residency in nutrition. So if you wanted to become an expert in nutrition as a medical doctor or an osteopath, there's no path to do that through a residency. So when you go to your doctor, let's set the stage here. When you go to your doctor and they tell you nutrition's not important, and they tell you how rare nutritional disease is, what they're really telling you is something they don't have the qualification to speak on. They're talking about something they're not an expert in. Unfortunately, in the U.S., I don't know if this is true in every country, but in the U.S., the medical license gives doctors kind of a carte blanche to practice nutrition, even though they don't have any training. But in most patients going to see your doctor, I mean, raise your hand if you're one of these patients. Did you think that your doctor had nutritional training? How many of you think your doctor had nutritional training before hearing what I've just told you? I'd love to see the answers down below. But the reality is they can practice nutrition, but they don't train in nutrition. So they're not qualified to make the statement that scurvy's rare. They're not qualified to make the statement that B vitamin deficiencies are rare. They're not qualified to make really any statements on nutrition unless they've done some more aggressive postgraduate training. Like myself, I've got an extra 2 years of postgraduate training. I'm a diplomate with the American Clinical Board of Nutrition. So I've gone on to study and to add a lot more detailed information to my knowledge base. Plus, I have 25 years of clinical experience working with patients. So again, most doctors don't practice nutrition, they don't study nutrition, and so there's no experiential ability for them to make great judgment calls. So let's dive in now to how different vitamin deficiencies have actually been shown to mimic different diseases and end up in patients getting wrong diagnoses. So the first one that we're going to talk about is vitamin C. Now, just a little mini crash course on vitamin C. It's a water-soluble vitamin, and you get it predominantly from eating plant-based materials, anything that has bright, vivid colors, orange, green, red, yellow, blues. Those pigments in those foods are largely vitamin C-based pigments. Vitamin C's primary role, or one of its primary roles, is in the formation of collagen. Now, collagen is the structural protein that makes up your skin, it makes up your hair, it makes up your bones, your tendons, your ligaments, your joints. It's very, very important as a structural element in the body. And so if you don't have adequate vitamin C, what ultimately happens is your collagen, which is a trihelix or a triple helix, it kind of looks like this if you blow it up very close, and it has these little rungs in between it. Vitamin C, one of its jobs is to form that rung to make the collagen elastic and tensile strength very, very strong. But if you don't have vitamin C, these little cross links don't form properly and your collagen can rupture more prematurely. And this can lead to a lot of different types of symptoms, and it can lead to misdiagnoses. Let's look at what some of these are. So this first one is a report on scurvy. Vitamin C deficiency disease is called scurvy. So if somebody's vitamin C levels are low enough, we call that scurvy. If you remember, the pirates, you scurvy dog, this is where that term comes from. Those long sea voyages where sailors didn't have adequate ability to consume vitamin C, and so they developed scurvy as a disease. So you can see here, scurvy is a disease caused by chronic vitamin C deficiency. The greater prevalence was found in the pediatric population with neurodevelopmental disorders. So the thing about autistic kids and kids with other neurodevelopmental disorders is they have very, very meticulous eating patterns. They have texture issues, they have flavor and taste issues, and so they're very selective about what they eat. And this puts them at a much greater risk for developing vitamin C deficiency. A lot of them, I've known several that they're very fond of things like chicken nuggets. They're very fond of French fries, fast foods that have the same type of fried-like texture, and there's no vitamin C in those foods. And if their diets are predominantly that, it's a lot easier for them to develop vitamin C deficiency. But in this case, you see here, our case reported a child with autism who presented with arthralgia, which is joint pain, and anemia. Systemic lupus was the first diagnostic impression. After the child was treated with ascorbic acid, however, the child's symptoms resolved. So what was happening is this child was being treated not with vitamin C, non-responsive. That led to further investigation where they identified the child was low in vitamin C and treated the child, and the symptoms recovered. Furthermore, parents and physicians should be concerned about nutritional status. Now, how can physicians be concerned about nutritional status when they don't take nutritional training? Again, going back to the premise of what we talked about, especially in children with restrictive dietary intake. Here's the patient's perspective, right? At first, I was afraid my daughter might have some severe illness. So the doctor doesn't know anything about nutrition, is diagnosing lupus. Lupus is a scary, scary disease. It can cripple people, and it comes with a broad array of immune-suppressing treatments, very dangerous medications to be taking long-term, especially in a child. So imagine being the parent of that child and getting that diagnosis, and that's what you're being told. and it's a simple vitamin C deficiency. And anyway, when the doctor said that my daughter had to be consulted with a pediatric neurologist, it made me feel nervous. After my daughter was consoled, she was pretty normal. My anxious feeling was relieved when we have known the exact cause of the illness. They finally figured out it was vitamin C. The doctor explained to me about the disease and treatments extensively. Learning points: scurvy should be considered in a case presenting with musculoskeletal manifestations, muscle pain, muscle aches, arthritis, joint pain, leg pain, limping gait, so if children are limping. Refusal to walk is also a sign because of the pain. So, point being, lupus can be misdiagnosed. Vitamin C could be mimicking that condition. And if the doctor doesn't know to measure vitamin C or doesn't know to think about measuring vitamin C, we get prolonged treatments for a disease that the child or the patient doesn't even have. And that has a profound impact, not just from the patient's like pure health perspective, but also from a cost perspective. This is another study on scurvy masquerading as reactive arthritis. In this case, patient developed a rash and left ankle pain of 1 week's duration, as well as a fever after 3 weeks of a productive cough, sore throat, hoarse voice, and general malaise. 6 days prior to presentation, had redness and swelling of the dorsal aspects of both hands with accompanying rash, and 2 days prior to presentation, developed a similar rash on the legs with associated left ankle pain, redness, and swelling. Reported eye redness, pain, photophobia or sensitivity to bright light, crusty eye discharge, and pins and needles sensation on the soles of both feet. Additionally, had noted difficulty with urination over several days. These were the rashes that you can see. You can see the little petechial rashes sticking out on the skin. Patient was mildly low potassium and hypoalbuminemic, which means low protein. So the patient had low protein, malnourished basically, low protein, low potassium, had slightly elevated international normalized ratio, which is a measure for clotting. Further questioning revealed that his diet consisted mostly of soda and energy drinks, and the vitamin C level was subsequently checked and found to be at zero, no vitamin C. And I see this quite frequently. I'll see scurvy a couple of times a week in my practice in patients with musculoskeletal problems and neurological problems. And in this case, the vitamin C was measured, it was zero. A diagnosis of scurvy was made and his symptoms improved at the hospital while maintaining a diet with normal levels of vitamin C. His rash had markedly improved by hospital day 2, joint swelling decreased, and the conjunctival injection and eye pain had resolved. Upon outpatient follow-up, his rash and joint swelling continued to improve, and he had not experienced any further hair loss, because in this case, this gentleman also had hair loss that had stopped as a result of vitamin C. Remember, I told you vitamin C also, it makes collagen, which is what your hair is made out of. Here's another case. This is an interesting one reported. This is a 40-year-old male with Crohn's disease who was initially misdiagnosed with vasculitis, but was later shown to have scurvy, vitamin C deficiency. The patient's diet was nearly exclusively made up of highly processed fast food with no fresh fruits or vegetables. Well, folks, that's the vast majority of the population nowadays. Fast food diets with very few fruits and vegetables. A mildly sensitive Bilious rash on his lower legs, mild gingival hemorrhage, and enlargement and muscle soreness were among his symptoms. Anemia and undetectable vitamin C levels were discovered in lab studies. A misdiagnosis might result in unnecessary treatment. So ultimately, had this patient been, if they continued to call his condition vasculitis, that was the misdiagnosis, the initial misdiagnosis. He would have gone through treatments and medical studies and everything else that weren't necessary. And in this case, simple vitamin C led to resolution. You can see here the rash that the patient showed up at the hospital with. You can see the small red dots here. You can see the larger conglomeration, the erythematous patch, if you will, here and here where it's super red. Okay. And then they also found corkscrew-like hairs. So if you see little hairs that look like they're shaped like a corkscrew, that's your cue to think potential vitamin C deficiency. But this was at onset, and this was after treatment. So you can see the legs completely cleared, the rash completely went away after vitamin C administration. And it doesn't take a lot of vitamin C to correct these types of deficiencies. 1,000, 2,000 milligrams a day is generally enough, depending on the depth of deficiency and how long it's been there. But remember, folks, scurvy can kill you. So if a doctor misses the diagnosis, you might go on and have enough problems with it that it creates internal hemorrhaging, because when you don't have enough vitamin C, your blood vessels break so easily that you can actually have internal hemorrhaging, which is basically you lose blood internally inside. Here's another one, scurvy masquerading as cellulitis. Scurvy continues to be found regularly in the elderly and those who abuse alcohol. Clinical findings result from decreased collagen production. That's what I was talking about earlier. Ascorbic acid is a necessary cofactor for proper collagen formation. Clinical findings can vary from bleeding gums, hair abnormalities, poor wound healing. I mean, who would be a classic person that we might think about with poor wound healing would be a diabetic. And diabetics, are very, very frequently low in vitamin C in my experience. But hemorrhage and sudden cardiac death. So death. Response is typically rapid and impressive with dietary replacement. So vitamin C deficiency responds really well to supplementation. In this case, 61-year-old Caucasian male presented to the ER with a 2-week history of asymptomatic lower extremity erythema, swelling and subcutaneous nodules that had failed to respond to multiple courses of intramuscular and oral antibiotics. So they were pumping this guy full of antibiotics, calling it infection. And this is what I'm talking about earlier with the lack of training. The guy shows up with a rash. It's automatically assumed the guy's got an infection. And what do? They proceed to use antibiotics. And look, antibiotics are they're not a benign treatment. Like, antibiotics come at a cost. So they're pumping this guy full of antibiotics, and what does that do? It wipes out his microbiome. It can increase permeability of the gut. It can cause a host of other complications. In some cases, antibiotic use can drive tendinopathies and lead to major musculoskeletal pain problems that last for months to years. So not a benign treatment. In this case, vitamin C, again, was later found. So the physical examination revealed a non-tender, deeply erythematous plaque on bilateral lower legs, a targeted history, which is what should have happened at first. Like, that should have been the first thing that was done, as a targeted history, revealed poor nutritional status secondary to poor diet and dentition. A diagnosis of scurvy was rendered, and the patient was started on oral vitamin C replacement. You see here 500 milligrams 3 times a day. With meals. Lab evaluation for serum C revealed extremely low vitamin C levels, less than 0.1 milligrams per deciliter. There was a rapid improvement with a decrease in the erythema and warmth over the next 4 days, and the patient was discharged from the hospital. There's a saying that I was taught, and most doctors are, and that is 80% of the diagnosis has actually been researched, is from a patient's history. When the doctor takes enough time to have a conversation with the patient, ask the right questions, typically 80% of the accuracy of the diagnosis is found within the context of having that conversation. How many of you have gone to a doctor and maybe you got 3 to 4, maybe 5 minutes with the doctor, maybe you spent more time with the nurse than the doctor, or maybe you spent more time with the med tech than the doctor, and the doctor just comes in and asks a couple questions, writes you a script, and walks out the room? How can you do a proper medical history in that short constraint of time frame? And especially if you're not trained in nutrition, how can you do an accurate medical history as it relates to nutrition? This stuff makes me mad, and it should make you mad too, because a lot of people get on. How many people are actually on medications or going through treatment because they're malnourished, then their doctors haven't been trained about it, and so they're just being misappropriated and mishandled and it's not benign. Like I said, it's very much to their detriment. Here's another one, nutritional deficiency masquerading as neurological disorders, scurvy-induced paraparesis. This is a case. A 5-year-old child started having trouble walking and standing, and so quit walking, right? So you can see your 5-year-old child presented with an acute onset inability to stand for 3 months. She had tenderness on moving the knee and ankle. The neurological exam was normal, and that's a really important clue because a lot of times with paraparesis or when somebody has like an ascending paralysis or neuropathy, where they're losing nerve control over their muscles, and that's why they can't walk. In this case, the nerve exam was normal, meaning this girl didn't have any neurological abnormalities that were driving that. So then they did dietary history and revealed food selectivity. So this child was very picky on the diet. X-ray of the knee was suggestive of scurvy. There were certain findings in the X-ray, and the vitamin C level was low, so scurvy was considered. She was treated with diet modification and vitamin C. She improved and began standing on the 3rd day. That's how fast she reacted. Now imagine if this diagnosis had held and they would have kept treating her in another way, and it was imagine your child having that. And then walking on the 10th day of vitamin C therapy. Scurvy should be considered a differential diagnosis in children with acute or subacute pseudoparalysis of the lower limb. So there's some examples of vitamin C scurvy being misdiagnosed as other conditions. And as always, if you want the show notes, type in wrong diagnosis below and I'll get you all the slides.